Hi, everybody, and welcome to the webcast. My name is Teresa Lanowitz, and I'm Chief Evangelist with LevelBlue. And today we're going to discuss the 2025 LevelBlue Spotlight Report, Cyber Resilience and Business Impact in Healthcare. Now, why is this research so important? This research is a vendor-neutral, forward-looking, actionable bit of research. And you can use this inside of your own organization to figure out how you're comparing against your peers in healthcare. What are you concerned about versus what the survey results are telling us? How are you managing different types of attacks versus what the survey results are telling us? Use this as a guidepost. Use it as a way to figure out how your organization should be preparing and looking for opportunities and challenges in the future. So what we did is in January of 2025, we went out and surveyed 1,500 cybersecurity leaders. That's C-suite, C-suite -1, C-suite -2. So the decision makers in cybersecurity. And of those 1,500 survey participants, 220 of them were from the healthcare industry. And this research focuses on the results of those 220 cybersecurity professionals in healthcare. And that's what we're going to talk about today. And you've heard me use the term now, cyber resilience, a couple of times. What do we mean by cyber resilience? Cyber resilience is the way the entire organization comes together when there is some type of either a cybersecurity event, a man-made event, or a natural disaster that impacts that IT estate. So if there is a breach, who comes together to help remediate that breach? It's more than just the cybersecurity team. If there's some type of outage caused by a hurricane, a fire, some type of natural disaster, who comes together to bring that IT estate back online? And also, how do you continue to run your business if you do have some type of event that impacts your IT estate? So for example, in a healthcare situation, if all of your systems are offline, can you continue to, for example, admit patients through your emergency room? Can you do it with paper and pencil? Do you even have the paper inside of your organization to be able to continue to admit patients and continue to run business as usual? And how do you bring that business as usual services back online? So that's what we mean by cyber resilience. Now, today we're going to take a look at how cyber resilience helps to build business confidence, what that impact is of cyber resilience, some of those evolving attack vectors that we're looking at inside of cybersecurity organizations, inside of healthcare. And then what's going on with our supply chain. The software supply chain is one of those things that we've probably not thought a whole lot about inside of our organizations, but it is quickly becoming something that is critical to the way you conduct your business. And then finally, we'll conclude with how to become a more cyber resilient organization. So let's get started by looking at some of the key findings in this Spotlight report. Cyber resilience as a concept, as a need, is being elevated up to the C-suite agenda. And we have some interesting data that we can share. And this is a year-over-year comparison of healthcare participants through our LevelBlue Spotlight report on healthcare. So the way we read this bar chart is the gray bars, those are the results of healthcare participants from 2024. The blue bars are the results of survey participants from 2025. One of the big things we found is that 35% of healthcare respondents say that cyber resilience is not seen as a whole organization priority. And that's down from 42% in 2024. So what this tells us is that cyber resilience is seen much more favorably as a whole organization priority. And if we look at the bars in this bar chart, we can see that our 2025 bars, the blue bars, they're decreased for the most part from where they were in 2024. So that's positive. But if we look at the very bottom concern that executive leadership does not prioritize cyber resilience, that actually increased in 2025. 31% of healthcare executive leadership does not prioritize cyber resilience. And think about the big events that happened inside of healthcare organizations last year that would cause a leadership team to say, we need to focus more on making sure that our basic cybersecurity controls are implemented, things such as multi-factor authentication, for example, we need to make sure that we're implementing our basic cybersecurity controls over this concept of cyber resilience and focused on a more strategic way of viewing things. So that's the one area where healthcare did not fare as well in 2025 as it did in 2024. So think about your own organization. What are the barriers inside of your organization to cyber resilience? Do they line up with what we see here in the survey results, or is there something different inside of your organization? We also know that aligning cybersecurity with strategic business goals is critically important. If you align your cybersecurity team and your line of business, the cybersecurity team is able to understand the critical few objectives that the business wants to achieve every year. And what we found out is that 43% of organizations tell us that board level engagement as a top goal is something that they're doing to actually handle incidents and minimize losses from a cybersecurity perspective as well. So it was encouraging to see that over the next 12 months, healthcare organizations, their cybersecurity teams are saying, we want to align cybersecurity with the line of business. 44% said that. And 43% said we want to increase boardroom engagement. So those are encouraging numbers for healthcare organizations. So take this chart back, look at your own organization, and determine where your organization fits in terms of aligning cybersecurity and the leadership agenda, and how you're bringing cybersecurity into the fold of the line of business. We know that cybersecurity is a business requirement. It is no longer just a technical problem to solve. Cybersecurity is a business requirement. And we know that with this business requirement, if we treat cybersecurity as a business requirement, we can make sure that we're effectively aligning risk. We can make sure that cybersecurity is included in budget planning from the beginning of every project. And we can also innovate more. And the way we read this particular bar chart is the gray numbers, the gray bars, those are all of the respondents, all 1,500 respondents. And the blue bars are the healthcare respondents. So if we take a look at alignment of business risk appetite with cybersecurity risk management, healthcare and the overall survey participants both at 43%. So 43% say we're effectively aligning business risk appetite with cybersecurity risk management, meaning there's pretty good alignment between what the business is saying is a priority and how cybersecurity teams are treating those priorities. The second, we allocate cybersecurity budget to every project from the beginning. 46% of our overall survey participants are doing that. And 43% of healthcare participants say that they're aligning cybersecurity budget line items from the beginning of every single project. And this is critically important to do, because if you're not bringing cybersecurity in as part of the requirement, part of the budget for everything that you're doing, you may end up with some type of cyber architecture failure where you have to go and add things in at the end. And that just costs a lot more money, and you may do it after there's some type of attack. So allocating cybersecurity budget to every project from the beginning is something that's critical. And the third item, we can risk more with innovation because we take an adaptive approach to cybersecurity. 61% of our overall survey participants are saying this, as opposed to only 55% of healthcare organizations. So the idea of innovation is incredibly important. If you look at healthcare, the types of innovation that you're doing, things such as wearable computing for post-surgical monitoring of a patient, the ability to use robots, for example, to disinfect exam rooms or hospital rooms after a patient leaves or a patient is discharged from the hospital. So being able to innovate more means that you can take that adaptive approach to cybersecurity, and also including these other things in terms of allocating budget for your cybersecurity component of the project from the beginning, making sure that you are effectively understanding what that risk appetite is from the business and aligning that with cybersecurity. All of these things come together to make a bigger business impact for cybersecurity and for the line of business. So let's take a look at some of the evolving attack vectors that we're seeing. We know that AI is a conversation that every organization is having. And if we think about what AI is delivering, AI delivers at a scale, a speed and scope that we have not seen in the past. So that size, scale, speed, and scope of AI is incredibly powerful. And it works in our advantage as organizations who might be using AI to our benefit, but the adversaries are also using AI. And if we think about generative AI has done so much to help organizations in terms of helping with reporting, helping get communications out, and so on. But the adversaries are also using generative AI quite effectively. And if we think about some of the things that the adversaries are doing, the phishing campaigns are getting much, much better. The smishing campaigns are getting much, much better. You're no longer getting that suspicious email from a prince in a faraway land who says, give me your bank account number and I'll deposit all of my money into your bank account by the end of the day today. The phishing campaigns, the emails coming in are getting far more sophisticated. They look very real. We also see that large language models now are starting to suffer from hallucination because of generative AI and bots actually writing source code and putting source code into these large language models or into an open source repository. Some of them may be creating source code that has actually nothing in a package. That package may be put into an open source repository. Somebody may take that package and try to do something with it, and it's empty. So this is leading to hallucination inside of large language models. And hallucination in AI is something that is just, it's false. For example, in generative AI, if you were to say, I want to know the capital of the state of New York, we all know the capital of the state of New York is Albany, but a large language model may have been trained incorrectly, and a hallucination would be the state capital of New York is San Diego. We know that's false. So some of these large language models are starting to hallucinate. This is where the human element comes in, and we have to make sure we're going back and we're checking things, and we're very, very rigorous and in tune with what our large language models are doing. So AI-powered attacks are certainly coming into play. They're ushering in this new type of threat that we have to deal with. And what we're also seeing is that deep fakes are becoming very, very sophisticated. So think of deep fakes where a voice is imitated or a video where some person is imitated and it looks and sounds exactly like that person that you know it to be, but it is a fake. And 62% of our healthcare organizations tell us it's becoming more difficult for employees to discern real from fake. And this is a real problem, especially in healthcare organizations. This number is quite high for healthcare organizations in terms of being able to discern real from fake. So these deep fake attacks are out there and they're becoming very prevalent. So what is your organization doing to fend off deep fake attacks? How are you preparing your members inside of your organization to understand what these AI generated attacks might look like and what these deep fake attacks might look like? We also wanted to find out from organizations what the most common attack type is that they feel would happen in the next 12 months. And it's no surprise that our healthcare respondents came back and told us that ransomware, 62% said ransomware is probably the most likely attack that we'll have to deal with, followed closely by phishing and business email compromise at 51% each. So these are the traditional attack types that healthcare organizations have had to deal with and remediate for the past decade or so. Another surprising bit of information is that 40% of healthcare organizations say that a DDoS attack is probably likely in the next 12 months. But only 38% of healthcare organizations say that they can effectively remediate a DDoS attack. So while DDoS attacks are likely, 40% say they're likely, only 38% can actually remediate and are prepared to defend against a DDoS attack. So this is one of the oldest attack types out there. So how is your organization prepared to defend and remediate against a DDoS attack? And this would be an interesting piece of data to take back to your own organization and determine how prepared you are. So in addition to these traditional attack types, ransomware, business email compromise, phishing, DDoS, and so on, we also wanted to find what type of emerging attacks healthcare organizations were grappling with. And no surprise, the AI-driven attacks were very high on this scale. So 49% say deepfake and synthetic ID attacks are very high, 49%. Then we have smishing. These are attacks that are executed through text messages, and quishing. 43% said that quishing attacks are high on their concern list. Quishing attacks are scanning a QR code, and especially if you're asked to put in any PII or PHI, there is a big potential for attack with QR codes. So be very careful of QR codes. And again, how is your organization, especially from a healthcare perspective, where you may be asking people to put in both PII and PHI, how are you dealing with potential quishing attacks? And a big surprising number that came out of these new attack types is that only 29% of healthcare organizations say that they are prepared for AI-powered attacks. Those generative AI attacks that might come in the way of phishing, those big attacks that might come in terms of maybe something was actually included into an open source repository that you might use for source code somewhere. So these AI attacks are coming at a size, a scale, a scope, and a speed that we haven't seen in the past. So it's interesting to take these two pieces of data, these last two charts that I've shown, take it back to your own organization and determine how your organization is prepared to remediate against these different types of attacks. We also know that you have to build resilience through investment. And we asked our healthcare survey participants, to what extent is your organization investing in any of these measures to prepare for emerging cyber threats? So those are the things like the AI-powered attacks, deep fakes, quishing, smishing, brute force attacks, and so on. And 64% said that they are prioritizing investment in application security, making sure that that application that they're running does not have any type of security vulnerabilities in it, or minimizing the security vulnerabilities that actually exist in that source code. And we can see these new types of attacks, these generative AI attacks that may come from taking open source code from an open source repository. Organizations are preparing for them by investing in application security. So this is something that's completely new that we've uncovered this year in 2025 in our research, because application security is now becoming one of the biggest things that organizations are concerned about. Think about how many third-party APIs you're using. How do you know that that security for those third-party APIs is actually on par with what your organization is requiring? Are you doing inspection of those third-party APIs that you're using? Are you doing inspection of that third-party code that you might be bringing into your organization and running? So investment in application security is quite high in 2025. So what about your organization? What are you doing to make sure that you're investing, to make sure that you can defend and remediate those attacks that might be coming now and in the future? We also know that bringing in trusted third-party advisors is a hallmark of how healthcare organizations really plan and prepare for the future. So the top 3 areas where healthcare organizations are bringing in those trusted third-party advisors is they're bringing in managed security service providers. This is especially true in healthcare organizations that may be in a more distant or rural type of area, where maybe cybersecurity skill sets are a little bit less available than in a major metropolitan city. Bringing in these trusted third-party advisors to help with managed security services. So for things such as endpoint protection, remember, everything that is connected to the internet is an endpoint that needs to be protected. That means any type of payment systems, any type of surgical instruments, any type of vital sign monitoring, those are all endpoints and need to be protected. A lot healthcare organizations are using managed security service providers to help with that, also to help with threat detection and response and so on. They're also bringing in threat intelligence providers, so making sure that they're getting the latest threat intelligence from reliable sources. And they're also bringing in cybersecurity consultants. And the cybersecurity consultants can help with a wide array of problems or solutions that you might want to impact. They can certainly help identify what your security posture looks like. They can help with tabletop exercises. They can help with exposure management, vulnerability management, and so on. So what about your organization? What type of trusted third-party providers are you bringing into your own organization? And these trusted third-party advisors, they typically work as a strategic extension of your team. So they're not just consultants that you look at every now and then. They are people who are in there, they're working with you on a regular basis, and they're helping you to achieve better business outcomes. We also know that software supply chain, we've touched a little bit on software supply chain, but the software supply chain introduces risk. Think about where your software is coming from today. You might be getting some parts of your source code that you run from open source repositories. You might have third parties writing your software. You might have global systems integrators that you've been working with for years writing the software. You may be bringing some software in from your own software library, things that you've written many years ago, new bits of source code that you've written. And you're also bringing in commercial off-the-shelf software. So your software is coming from a variety of places. What type of visibility do you have into the security of all of those pieces, all of those components of software that you're bringing into your organization to run your healthcare business? The 54% of healthcare organizations say that they have very low to moderate visibility in the software supply chain. So that's a startlingly high number of organizations that have low to moderate visibility into their software supply chain. And we asked, what are the most important factors driving a need for better software supply chain visibility within your organization? Only 23% say that it is to assign or create a confidence level of suppliers. Think about the software that is running your business. How much of it did you write? How much of it have you done peer reviews on, software inspection processes and procedures on? So only 23% say that it is to create a confidence level of suppliers. Another shocking number is that only 25% say that it is to conduct cyber forensics, and only 26% say that it's to complete the software bill of materials, or the SBOM, the software bill of materials. So, and only 32% say that they want to be able to identify third-party ingredients in source code. So the software supply chain visibility is very low inside of healthcare organizations, and there doesn't seem to be a sense of urgency around making that visibility better or understanding the quality and the security of what your third-party suppliers are actually bringing in. So what we've concluded from these low numbers is that the software supply chain is definitely becoming a weak link in healthcare as well as other organizations. We saw this in the larger sample size as well. Our 1,500 survey participants also said that the software supply chain was definitely a weak link. But what we see in healthcare is that only 19% of our healthcare survey participants are saying that they're going out and prioritizing engaging with their software suppliers, those third-party software suppliers that they're working with, the third-party software suppliers that have been writing source code, the global systems integrators who have been writing source code, the commercial off-the-shelf software that they're using, the software that is being written to run the many endpoints that exist inside of the healthcare organizations. So think about your own organization, think about what's going on with your software supply chain, and take a look at other industries. This is a really interesting time right now in the retail vertical industry. Retail is being hit by a lot of ransomware attacks. Their software supply chains are being impacted because third-party APIs are being exploited. So think about healthcare and how you can extrapolate some of those ideas about what's going on in retail right now to what your own organization can do. So again, go back to your own organization and determine what type of visibility you have into your software supply chain. How are you looking at the security practices of those third-party suppliers in your software supply chain that you're working with? And then you want to build a proactive culture of cybersecurity. And that comes from eradicating silos that exist inside of your organization between the cybersecurity team, the development team, operations team, networking team, and so on. It also comes from aligning the line of business with your cybersecurity teams. So there's a lot to be really, really positive about inside of the healthcare organization. We're seeing that cybersecurity is moving in a very positive direction. 61% of our healthcare organizations say that their cybersecurity team is aligned with the line of business. And that's positive because what that does is it allows you to innovate more. It allows better security outcomes. It allows better business practices to be conducted. And the security team understands those critical few objectives of the line of business. So you don't have the security team off doing something that is completely the antithesis of what the business team wants to accomplish. So those are working together. We also see, and this is a very important point to take away, we see that in healthcare, 59% of all leadership roles have cybersecurity responsibility with KPIs and metrics attached. This is one of the key things that every organization can do, and 59% of healthcare organizations are doing this, that leadership roles all have cybersecurity components. It doesn't matter what that leadership role is, whether it is somebody in finance, somebody in the communications department, somebody in hospital administration. All leaders have cybersecurity responsibility with KPIs and metrics attached. That makes everybody aware of their responsibility for cybersecurity, making sure good cyber hygiene is implemented and so on. And then working with the workforce about social engineering tactics. 57% of healthcare organizations say that they're doing this, which is a step in the right direction because as an industry, cybersecurity, we've done a great job over the past 4 years or so at letting people know about ransomware attacks, about applying cybersecurity hygiene so that ransomware attacks are less and less of a concern. But where we're seeing this now with the advent of AI-powered attacks, AI-driven attacks, it comes down to a lot of social engineering. And 57% of healthcare organizations are making sure that they're educating their workforce about the perils of social engineering attacks. So there's some really positive things going on in healthcare and the way you're looking at cybersecurity and how you're implementing cybersecurity. But there are also areas for improvement, most notably inside of incident response plans. Only 38% of healthcare organizations have a codified incident response plan. So that means that the remainder of healthcare organizations, that 62% of healthcare organizations who do not have a formalized incident response plan, when there is some type of incident, some type of cybersecurity incident, some type of natural disaster, some type of man-made disaster that takes your IT estate offline, they are acting in the moment. They're trying to figure things out as the crisis is unfolding. So this idea of having codified and formalized incident response plans is critical. That determines how your organization responds when something unforeseen is actually happening. So making sure you're working with a cybersecurity consulting team to do those tabletop exercises to understand what an incident response actually looks like. Who do you bring into the fold? How do you communicate outward? When do you communicate outward, and so on? These are all critical areas of an incident response plan. So working on formalized and codified incident response plans is one thing that healthcare organizations can do to better improve their cybersecurity posture. The other thing, only 32% of healthcare organizations say that when there is a merger and an acquisition that is taking place, only 32% of them conduct due diligence for mergers and acquisitions as it pertains to cybersecurity. So this is something that every organization should be concerned with when they're focused on a merger or acquisition. How does your cybersecurity posture, how does your cybersecurity readiness, how does it stack up against the company that you're acquiring or merging with? So conducting that due diligence is, again, something where healthcare organizations can definitely improve. So again, go back to your own organization. What are you doing in terms of your incident response plan? Do you have an incident response plan in place? Have you worked with somebody to help get an incident response plan in place? Do you conduct due diligence for mergers and acquisitions around cybersecurity? What are you doing? Do you have a company-wide cybersecurity culture? These are the types of things, these are the types of questions that you can actually take back to your organization and prioritize in terms of, we want to do this in 2025, we want to do this in 2026, to make overall more effective outcomes and to align cybersecurity and the line of business. And now every organization definitely wants to become more cyber resilient. They want to be able to come together when something unforeseen happens, whether it's a cybersecurity incident, a man-made disaster, or some type of natural disaster. To do that, there are 4 basic steps, and we talk far more about this inside of our Spotlight report on healthcare. But first is elevate cyber resilience in the organization. Make sure everybody understands what cyber resilience means. Make sure everybody understands what their role and responsibility is in terms of keeping the business online, keeping the business afloat when something unforeseen happens. And then foster that cyber resilient culture. Make sure that you're budgeting for cyber resilience. Make sure that you're implementing those incident response plans. Make sure that you're conducting due diligence on mergers and acquisitions, those types of things. And be proactive and intentional with what you're doing from your cybersecurity teams. Most cybersecurity teams operate in a very reactive and transactional mode. Make sure that cybersecurity is something that is proactive and intentional. Make sure it doesn't get in the way of conducting business. You want to remove the friction and make sure that you have moved beyond just the tactical planning of, hey, we have to have these controls in place, to making sure that you understand everybody's role and responsibility for cybersecurity across the organization. And then prioritize looking at new areas where these types of attacks may emerge, specifically the software supply chain. Prioritize the visibility of your software supply chain and those third-party suppliers who are supplying you with any type of software. Open source, commercial off-the-shelf solutions that you might be using, third parties that you might be using to write source code, global systems integrators you might be working with, and also the library of your own software that you might be integrating into your overall systems that you're using. So you can take these 4 steps to become far more resilient and more cyber resilient inside of your own organization. So take this as a guideline back to your own organization. And again, thank you so much for joining me today. You've been a wonderful audience. We invite you to visit us at levelblue.com. As a thank you for attending this webcast, you will certainly get a copy of our 2025 LevelBlue Spotlight Report, Cyber Resilience and Business Impact in Healthcare. But if you want to visit us to learn more about that specific report, please visit us at levelblue.com/spotlighthealthcare 2025. Thank you for joining me today.